Hey everyone, so I want to go over today the ins and outs of what to expect from Tommy John surgery. So if you're a pitcher that's currently undergoing Tommy John rehab or you just want to learn more about it, this video is for you. So what is Tommy John surgery? Tommy John surgery is a popular name for ulnar collateral ligament reconstruction. So this surgery involves removal of that native injured ulnar collateral ligament, which is also called your UCL, and it's then replaced with a graft that's typically either from your hamstring or the wrist forearm area. Typically, this is a tough surgery for pitchers to deal with, both physically and mentally, because the recovery to return to pitching is 12 to 16 months. That UCL is the primary restraint to valgus forces along the medial, the inside part of your elbow, during the throwing motion, especially during layback when you're in maximum external rotation. So who needs Tommy John surgery? Out of all baseball positions, pitchers are most likely to sustain a UCL injury due to the greater stresses that are placed on their medial elbow from throwing at higher velocities repetitively. Many pitchers will get injured on a single throw. Sometimes they'll feel or hear a pop sensation. However, it's not that single pitch alone that was the main cause of their injury. Rather, it's the chronic microtrauma on that UCL from pitching that ultimately leads to failure of the ligament. So pitchers that sustain a complete tear of the UCL, they're going to need Tommy John surgery to get back to pitching successfully. Pitchers that have a partial grade tear will always want to start with conservative rehab first, so non-surgical rehab. But if they have a couple different courses of failed non-surgical rehab, like on 1 to 2 different times they try and they just can't get back, they might end up needing Tommy John surgery as well. So now that we know a bit more about Tommy John surgery, I want to go over what pitchers should expect throughout that rehab process. So you'll be in a splint for roughly the first 7 to 10 days after surgery, and then you'll get your stitches out by your physician roughly around that 2-week mark. During this time, you really just focus on wrist and hand range of motion. The biggest thing to focus on here to avoid is excessive sweating, since that can potentially lead to infection at the surgical site. From weeks 2 to week 8, the focus is on restoring full elbow and shoulder range of motion, along with starting some lower level loading of the rotator cuff, wrist, forearm, and scapular areas. The other big focuses during this time is hip and thoracic spine mobility, along with lower body and core strength, since all those are important when we talk about optimal throwing mechanics and velocity. For the next 4 weeks, the focus is going to be mainly on improving general upper body strength through foundational rehab exercises. This is the time of rehab, as long as there's not significant swelling in the elbow still. I like using blood flow restriction training with pitchers, since we can use lower loads that do not stress the surgical site, but it allows us to get early muscle strength and hypertrophy gains. At that 3-month mark, pitchers should be getting in the weight room doing more traditional upper body lifting exercises such as cable rows, dumbbell floor presses, barbell landmine presses, just to build a strong foundation of strength. Around that 4-month mark, this is when guys will typically begin an upper body plyometric progression, starting with 2-handed to 1-handed medicine and plyo ball drills, and progressing from there. The whole goal of this phase is to expose your arm and body to higher intensity movements in preparation for the upcoming throwing program. Once a pitcher is able to successfully complete that entire plyometric progression, they have a normal clinical examination, meaning they have pain-free shoulder and elbow range of motion, they have adequate rotator cuff, external, internal strength, amongst other things, and ultimately they have to be cleared by their physician. They will typically begin a flat ground throwing program around 5 months post-surgery. Some guys might start as early as 4 months. I've also seen it in a case where some start closer to 6 months. It really just is dependent on each specific pitcher and when they get cleared by their physician. So the throwing program. Generally, the first couple months of that throwing program will just focus on building throwing volume on flat ground and distance for a couple months. Once we get to the roughly 9-month mark post-surgery, that's typically when mound work will start. And then, like we mentioned earlier in this video, return to competition, pitching in games is typically around the 12 to 16-month mark after surgery. So that's a quick rundown on what you should expect during Tommy John rehab. If you're interested, you can check out below for a free link to our 3-day rotator cuff strengthening arm care program.